Of course, that I would look younger. um, and the skin above my eyes was really bothering me. It was a nuisance. It was in the way of my sight also. So it was really something that I did, not just for the looks, but also for my sight.
For your vision?
For my vision. Oh gosh, will I ever look the same? It's pretty frightening if you've never had anything, any plastic surgery done to your face. The bruising and the swelling is a little overwhelming. Well, I'm home. I'm feeling much better. The only really discomfort that I have is a little bit in my stomach area, and not being able to see. My eyes are a little blurry from the salve and medication. Other than that, I feel good. Oh wow, my eyes look really different. Really. Even here too. Amazing.
What do you notice most as being different?
Mostly that you can see more of my eyes. I mean, my eyes are lifted up more. I can tell a lot in here, but of course the swelling. But
Do you like what you see so far?
yeah. Awesome. So far so good. New me. I've never had any surgery done to my face or even had to heal in any way from anything, accidents or anything to my facial area. So it was kind of dramatic the first couple of days. But it kind of goes like Dr. Harris says in her paperwork that, you're going to feel some depression. You're going to feel a little isolated. You're going to feel a little different, because you do have to stay, out of the view of other people because of the way you look. I was standing in line at Walgreens, and the lady behind the counter looked at me like, "Oh, poor pitiful you. Let me get you out of here real quickly." So that was kind of a different experience. But as the swelling goes down and the healing process begins, you begin to see what you're going to look like, within a few days even. By the end of the week, I could really tell, what my eyes were going to look like, even underneath the bruises and the swelling. I could see a great difference in them, so I was really pleased with that. But you do go through different emotions. You go through I did, a little bit of depression. Like I said, looking in the mirror and saying, am I ever going to look the same again? But you actually look better, so that's the good thing. Scarring, if there was going to be any scarring around my eyes, because you have these lines where the incisions are for the first week, and that's really all you see is that. You see where those incisions were, and even though it's just a thin line, you're wondering, is that going to go away? Is it going to stay there? So that was kind of a concern of mine. But as the months went by, my eyes were a little tight. I didn't know if they were ever going to feel comfortable again, with my facial movements. So once I got past that point, your eyes go back to normal. It's just a normal process. Some people noticed right away. Some people said, "Oh my gosh, what have you done? You've done something." They couldn't figure out what it was, but they knew I had done something. Other people, it took a little while. They'd look at me and then they'd look at me again. But I wear glasses most of the time, so that helped with some of the bruising. Before the bruising went away, just having my glasses on kind of helped the under eye bruising that I had. So, but it was definitely people did notice. They did say something's different, but it was so subtle that they really couldn't tell what. So that was what was nice about it. Well, I did exactly what Dr. Harris said to do in her notes to you. Don't go out and buy all these expensive things to wrap around your eyes or ice packs or anything like that. Just frozen peas in a Ziploc bag is the best. It forms to your face. It worked perfect for me. It was very lightweight. It wasn't heavy. It wasn't too cold. And then the hospital gives you this really cool little thing that fits over your eyes, and I still have it. I still use it. I mean, it's wonderful, and it was very helpful in keeping the inflammation down. And I also used a salve, vitamin K salve. I'd suggest that. Don't take the vitamin. Just take just use the salve. So, and I kept salve on my eyes for months after. I always kept the incisions moist, and that helped with the healing. Well, that was a little different. At first, bright, puffy little cheeks, and it was swollen. I think the most painful part of that was actually the injections that was made into my stomach area to draw the fat out. That was very painful. The liposuction, yes. My stomach was very bruised for months, maybe 2 months after. But the fat injections slowly kind of calmed down and contoured my face, and I've been real happy with that. So, yeah. Well, first of all, make sure you get a good doctor. That's the most important thing. Check their credentials, make sure that they, look at some of their work, what they've done, see their testimonies. But also just, it's a wonderful way to just take a few years off of your life, and make you feel younger and prettier and in that middle age, when you're starting to wrinkle a little bit and sag a little bit, and, your face is kind of sunken in. The fat transfer was awesome because it just plumped up my face and just took all those hollow parts of my face out. And of course the eyelid was wonderful. That just took years off my life. I mean, I think 10 years actually, just by a little bit of skin being removed from my eyelids. So.
And your vision?
Yes, my vision is much better, much better. I could tell a difference right away.
Mainly because the weight had been lifted off your eyeballs?
Yes. Mainly because I didn't have the weight of the skin on my eyelids. Well, I know I'm going to be really glad that I did this because in 5 years that skin would have been even worse, and I think that my eyesight would have really been affected by it. So I'm just looking forward to looking 5 years younger 5 years from now.